Well, welcome back to the main stage. I'm truly excited to hear from the 5 startup companies who are going to be presenting in the next session. If you heard my presentation on the constellation, these 5 companies would be considered private partners in that constellation. And they're creating solutions that we all need to help mitigate risk and close gaps in care. To moderate this panel, I'd like to introduce Anna Kasani. Anna is well known in the women's startup space and most recently led Springboard's Dolphin Tank program to provide entrepreneurs friendly feedback and connection to one another, as well as advice and resources. Anna, welcome to the main stage and welcome panel.
Thank you. Thank you very much. Wonderful. Well, great to get started and lead this session featuring our 5 entrepreneurs. First, I'd like to bring on camera and have our expert panel introduce themselves. Ella, Natalie, and Tamaya. Ella, will you introduce yourself?
Hi, everybody. My name is Ella Schwartz, and I work at the California Healthcare Foundation. I'm on a small team of impact investors. We are called the Innovation Fund, and we invest in early stage health tech startups and help them scale with Medicaid partners in California. Nice
Wonderful.
to be here.
Thanks, Ella. And Natalie?
Hi, good afternoon, everyone. Good to be here. Thanks for inviting me. My name is Natalie Chung. I'm a board certified obstetrician gynecologist with more than 25 years experience. I'm honored to work at CVS Health as the senior lead for the joint ventures and the accountable care organizations. Good to be here.
Fantastic. And Tamaya?
Hi, everybody. Also very glad to see everyone today. I'm Tamaya Good. I'm an associate investor with RH Capital, a venture fund of RIA Ventures, and we invest in women's health tech across all spectrums of health tech and very much focused on maternal and reproductive health.
Wonderful. And again, I'm Anna Kansani, Vice President of Community and Partnerships at Springboard Enterprises. I also have recently led the Women's Health Innovation Coalition, where we bring together all stakeholders in women's health across startups, investors, corporates, nonprofits, advocacy organizations, all trying to elevate and educate around women's health issues and also really push forward innovation and tackling the challenges that come up for startups in the women's health space. So very familiar with many of these companies presenting today. And again, this is Dolphin Tank style. So we are going to be as friendly and constructive as possible. The purpose is for these companies to present their companies, put their best foot forward, and then for us to be able to give feedback on what resonated and hopefully offer some connections and advice. So without further ado, we'll start with our first company presentation. We have Lauren Elliott with Candlelit Therapy, also a Springboard alumna.
Yes. Hi, everyone. I'm Lauren Elliott, a founder and CEO of Candlelit Therapy. And is it all set to go? Am I all set to go? Okay.
Yes, when you're ready.
Awesome. Okay. At Candlelit Therapy, our mission is to make access to perinatal mental health care that's culturally competent, evidence-based, and peer-led simple for Black, Indigenous, and POC families. Each year in the US, nearly half of BIPOC women and parents develop what's called a perinatal mood and anxiety disorder by the time their baby turns 1. Unfortunately, half of these women never receive treatment due to lack of screening and diagnosis. I know because I was that mom. My son and I were only 1 day postpartum when I dealt with depression after bringing him into this world by a traumatic cesarean birth. This was only the beginning, and I didn't know I was suffering in silence. My experience with depression while serving as a public health professional gave me a deep knowledge in this space. At the time, I led large-scale million-dollar mental health campaigns designed for communities of color, and am today supported by a team of healthcare executives and clinicians. We're designing our service for the nearly 2 million women of color who share birth stories like mine each year and experience inequities that have been exacerbated by the COVID-19 pandemic. So we're filling a huge gap in the diversifying market by addressing both mental health screening and treatment. Present-day methods used to detect risk of mental illness among Black and POC families are highly subjective and don't catch underlying and untreated symptoms they experience. But we enable a more accurate and culturally sensitive care model that works inside and outside of the doctor's office. Parents learn about us from their doctors who refer them to our app for the right level of care at the right time. We act as a glue between providers, payers, and parents throughout the 4 trimesters and beyond in order to make warmer handoffs between maternal and mental health care providers. We currently have 2 pilots running our flagship product, which is called Candlelit Care, with the largest health system in Indiana, and a payer who both see us as a fit to reduce Black maternal health disparities. Black women in particular are less likely to be screened for PMADs, perinatal mood and anxiety disorders, to be honest when they are screened, or to receive the relevant treatment with or without a diagnosis. So our platform is crucial. No one else has effectively engaged BIPOC parents in this way until now. We not only match moms with content approved by our Cedars-Sinai reproductive psychiatrist, who's an advisor of our team, but we offer symptom education and a continuum of care that today is fragmented and delayed for this population. We've done a lot with limited resources, but today we're asking for partnership with both private and public plans, health plans like Medicaid, state Medicaid, and small to mid-sized hospitals, health systems, to pilot Candlelit Care in additional underserved markets than we have already worked in, to accelerate our growth inside the next 18 months. Thank you for your time today, and I'm happy to take your questions.
Fantastic. Great job, Lauren. Thanks for that presentation. I really liked that you really set up the problem very quickly, got to who you're serving and what that gap is, and clearly stated where you're at in your business trajectory right now. So you have the 2 pilots, you're looking for additional partners. I have a few questions, but I wanna send it to our panel first. So Natalie, why don't we start with you? What stood out in Lauren's pitch, or any burning questions?
Well, first of all, Lauren, I really appreciate your presentation and speaking to where we are today in 2022, particularly coming through a pandemic. Women of color, Black women and Hispanic women are definitely in need of this. There are such inequities in terms of morbidity and mortality, and mental disorders and mental conditions, depression and anxiety, only make it far worse for the entire family beyond the mother. So in terms of, I would like to hear more about how the content meets the cultural needs of the population you're targeting. Tell me more about that.
Yes, Natalie, that's a great question. So we've specifically rooted we have digital cognitive behavioral therapy, but what we've done is culturally adapted. So we are not only tackling topics like breastfeeding, but we are referencing wet nursing and the historic component about breastfeeding among specifically this population. We're not only speaking about building your birth support team, but really how to advocate for yourself when you're in a clinical encounter with a provider who may not look like you. So we're really tailoring the content to specifically speak to barriers of access, stigma, specifically that we know are experienced by this population. Outside of that, we're also making it accessible. So we are not a native app, we're a mobile-enabled web app, so we can be accessed by an actual phone. Cell phone doesn't have to be a smartphone necessarily. We are also offering the content in a few different modes. So we're allowing parents to be able to listen to our content that deal with those different topics, as well as read and watch an actual video from an actual coach and therapist. So just giving some options in case mom wants to listen to us while washing the dishes or breastfeeding. But thank you. That's really important.
Okay, thank you.
Great. And we'll keep it kind of short with the panelists, and then we can always circle back if we have more time, but I want to get to everyone. So Tamaya, why don't we go next?
Yeah, thanks for sharing today, Lauren. This was good to hear about what you're building. I was really glad to hear about this being a product that can be used throughout the entire pregnancy, and so that a woman maybe is able to sort of track how she's going throughout her pregnancy over time. I'm wondering though, when does the patient get in contact with the doctor, and how does the doctor refer this app to the mom? What would be some of those signals that would make that happen? And is that the only way to learn about the service and use the service?
So that's a great question, Tamaya. That's one way, and how that one essentially kind of channel would work is we would sort of be the intervention that gets referred at a prenatal visit. So there are a few different checkpoints. Mom meets with the providers not as frequently in the first trimester. So we would align with whenever a prenatal visit would take place, or an actual trigger would happen. So let's say mom is screened for gestational diabetes and she actually has it. So we'd be the trigger essentially at that point to intervene, just because of all the sort of emotional and support that's needed around that sort of diagnosis. In addition to that, we would also leverage our channel partners. So we would be introduced to parents through their actual health insurance plans as well, and using their marketing channels to promote ourselves through email marketing, sort of things like direct mailers, just so that we are also kind of having this omni-channel approach to being able to reach out to parents in multiple ways beyond just their actual doctor's visits.
Great. I don't want to take up too much more time, but I do want to say I thought it was great that your ask was very clear and understanding where you are in your journey right now. That was really helpful to be able to think through the resources then that could be useful for you.
Great. And just because my question's a little related to Maya's, in terms of, so that's distribution from the doctor's office to the parent in terms of like when that gets triggered. In terms of scale and getting this in the hands of the doctors to then refer, I know you're looking for introductions to more healthcare systems, hospitals. What is that plan for that go to market for actual customers? Or is the pilot also teaching you kind of who best to target?
Yeah, we found that actual partnership with health systems has been more like helpful in gathering preliminary data of like, just like provider, how they feel about our app, or being able to sort of like leverage our app in those moments if they have enough time, for example, things like that. Those partnerships have been most helpful in that way. But they have said that essentially us including our screening component in our product has been super helpful because they already are screening moms, or they haven't been able to do it in a more standardized way, and it's not in a culturally competent way. So we've noticed that we've been filling a void in that capacity, specifically with the providers at health systems. So I'm thinking that could be what we sort of leverage as a channel. Yeah, as far as distribution. Yeah.
Okay. Yeah. No, really interesting. It's always good to know, like what, just like from us, like what resonates in the pitch, like what stands out for them in terms of biggest needs. You can lead with that in terms of getting it, in the hands of more people. And Ella, I want to bring you in. Things that stood out, resonated with you, or questions you have.
Thanks, Lauren. I have a few questions, so let's, Anna, feel free to cut me off at any point.
Okay.
And Lauren, really appreciate in your pitch you sharing your own personal journey, and thrilled to see you leading this work for birthing people in the U.S. And people who are facing inequities. So thank you. I have a few questions, like really kind of some basic stuff around language capacity on the platform. In California, we have a lot of Spanish-speaking birthing people. Wondering about the screening. You had mentioned that you're tailoring the screening. So I do wonder if it's tied to an evidence-based screener that is, nationally recognized in some way. Would love to understand how you're thinking about the value proposition for both payers and health systems, because they might be a little bit different. So what metrics are you tracking to demonstrate value over time? Is there a clinical value, a financial value, a patient engagement value? Which of that data do you already have, and what of that data would you like to have? Are you looking for evaluation partners or people to help you kind of prove that value over time? And what is some of your hypothesis about value proposition, so that we can motivate, additional pilot partners and payers to come on board with you? I'll pause there, but I still have more questions because it's so exciting and very necessary, and will take us a long time to solve this. So thank you for the energy.
Thank you.
Yeah, let's start with that. We just have about a minute. So Lauren, why don't you respond, and then we can finish with any last comments.
Got it. Yeah, and thanks for so many questions, Ella. So I'll tackle the first one. That we are already developing for English and English for sure, and Spanish is essentially our first dominant language. There is a huge Burmese population, and specifically the area where we're piloting with the hospital. So that is like the next language we've been considering, but Spanish for sure. And that's for our screeners and our CBT, our cognitive behavioral therapy program, that'll be available in Spanish as well. We are also we're leveraging clinically validated scales. So we're using PHQ-9, GAD-7, and then we've implemented our own sort of measures that are proprietary, but really using those two clinically validated scales to actually segue into our measurement outcomes. So we're focusing more on engagement. We've seen a pattern with that metric resonating with both health plans and health systems. So we are anchoring ourselves on how well we're able to keep parents engaged in the actual continuum of care. So throughout the 4 trimesters and beyond, specifically at these certain points or episodes of care throughout their journey. That's where we're anchoring ourselves. And lastly, we are also, I'm sorry, as far as, yes, as far as health systems, we are using them as a channel partner to help build up our data and sort of validate ourselves before we go to health. Well, as we are going to health plans, we're noticing that, yes, you're absolutely right. They do have different value props, but the health systems have been able to help us figure out how we're resonating with providers mainly, and how we're able to really help with that engagement and that continuum of care, since they are the ones that are mainly interacting with the patients.
Great. Awesome. And any other questions that the panel have? I'm sure Lauren would love more feedback and questions. So we'll definitely facilitate those follow-ups. Lauren, can you just restate your ask one more time? And also, are you raising money?
So my ask is for partnerships or introductions to partners, specifically private and public health plans like Medicaid, and small to mid-sized health systems or OB/GYN practices, so who see like around 4,000 up to 4,000 patients a year. And I am not raising right now, but I'm sort of gathering those connections as well.
Building relationships.
Yes, yeah. Building relationships. So
awesome.
So definitely welcome to that.
Thank you, Lauren. All right, and next up we have Anne Wandland from Canopy.
Hi, everyone. Tough act to follow. Lauren is doing amazing work, and I'm so grateful to be here. Anne Wandland from Canopy. To start, I'd also like to share a personal story because I think they are so important. That takes us back a few years to my son's 1-month well-child visit. I couldn't speak to his pediatrician or answer any questions about him without crying. And looking back, I understand myself in that moment better. My mental health history and experiences during pregnancy and childbirth without emotional support led me to that moment. The issue is very personal, but as we all know, it's massive. The maternal mental health care gap affects millions of us every year. Maternal mental health conditions are common, and research shows that about half of them are preventable. This is why we created a scalable solution to move from reactive mental health support to proactive mental health care. How does it work? An expecting or new mom will be connected with our mobile app through a provider or her health plan. She fills out an initial screening tool that allows Canopy's algorithm to customize a program according to her struggles and can connect her with emergency support. She then accesses an audio-based program wherever she is, whenever she needs it, using evidence-based techniques to prevent or address symptoms of anxiety and depression. At the end of the program, we calculate the change in her score using validated scales, and she can either continue to engage with other programs in the app, connect with additional support, or just come back to the app if or when she needs it. 90% of our app users who engage for at least 1 day report an improvement in how they feel. So we have our low cost and compassionate program is available in English and Spanish and is an American Academy of Pediatrics Star Center resource. When we created Canopy, we knew we needed to address the massive care gap, but we also realized there were financial incentives for risk-bearing organizations to prevent maternal mental health conditions because of the very high cost of not addressing them. Our customers are working to improve outcomes and reduce costs across the US and the UK, and they include cities, health plans, health systems, and employers. We have a great team of experts in behavior change tech, mental health, public health, and digital products for parents. Most importantly, for new moms with lived experience. We're also very lucky to have Dr. Alin Barrera, who is speaking tomorrow about her amazing work on mothers and babies as our science advisor. And for me personally, I spent the last 5 years before Canopy growing and leading organizations focused on maternal and child health outcomes in East Africa. So we've got about 2,200 users on the current version of our app, and our goal by the end of the year is to have 50,000 expecting and new mothers on our new platform that we're launching this Friday, so stay tuned. And we're looking for additional partners, including health plans and integrated delivery networks in particular are our ideal partner.
Fantastic. Great pitch, Anne. I really appreciated just some words that popped out for me was personalized plan. I think that is like a unique component. Also, how much you measure. I really appreciate kind of being able to see even day to day what the improvement is in the health of the mother, and also just the awareness of thinking about the stickiness of the app, the retention, and again, the measurement. So really appreciate that. I will jump into the panel. Tamaya, can we start with you this time? Things that resonated, stood out, or questions you have?
Yes, I think that I agree around the customized program that really stood out to me, and maybe I have a couple of questions around how you're developing that, or what some of those triggers are that would make it more customizable between mother to mother, and then also what's that connection and feedback loop like with maybe their provider. I'd love to hear a little bit more about how you're thinking about that, Anne.
Yeah.
Great pitch.
So, thank you. So we use 3 different therapeutic techniques. So it's interpersonal therapy, cognitive behavioral therapy, and compassion-focused therapy. So one of the things we do is kind of figure out what people are responding to, what they're liking and what they aren't liking, because we don't all like the same things. The same things don't resonate with us. But we're also kind of customizing based on, is someone struggling maybe with anxious thoughts a little bit more, or a little bit more low mood, or just general stress? Is it nursing or not nursing? Is it bonding, worrying about baby's development, sleep, challenges with relationships? These are all really common challenges that we've just collected over the last 1.5 years that kind of affect all of us. And so we really kind of honed in on those. So we put content and information in front of a user according to kind of this onboarding process. And we're also collecting data on social determinants of health and risk factors so that we can get really smart about, making sure we're slotting people into the care that they need really early. And then, sorry, what was your other question?
No, that's good. Just sort of understanding how that all works, and then the connections with the providers. But I know we have limited time here, so up to you. There might be some other good questions.
Cool. Yeah, we can always come back to that too. Ella, why don't we go to you next?
Awesome. Thank you, Anne. And really impressed. And I also have so many questions because now I want to know so much more about it. Ready for my demo. I guess my biggest question, and maybe this is just because you're going second, is how you differentiate from other apps. So I feel super excited about both pitches, and definitely find myself wondering how they're different. And I don't want to put you against your panel partners, but how would you answer that question if somebody asked?
Yeah, so we're really focused on prevention and population health, and kind of slotting into value-based care in particular. So when we think about our particular value proposition to our customers, it's about getting in as early as possible to avert and reduce downstream costs that are related to unaddressed mental health conditions. And so we're really focused as far upstream as we possibly can. I think the other things are, the kind of customize and the relying really on our tech to do that better and get kind of smarter over time, because retention and engagement are such big issues. A little bit better in digital health interventions, but still not good enough for what they need to be. So, that's a huge focus for our product development, and also just making sure we've got a good impact, that we're having a good impact. Yeah.
Great. And Natalie, let's bring you in. Things that stood out or questions you have.
Yeah, thank you so much, Anne, and thank you also for sharing. It's great to see how you have taken your experience to empower others and to help others. My question goes to you. I like how you mentioned data in terms of 2,200 participants, and you're looking at value-based approaches and social determinants of health. And to that point, any outcome data, how have you actually impacted the health of the women, the health of the families and the ladies that you have followed?
I am so happy that you asked that, because So we actually started out of a social impact and research focused incubator. So cost effectiveness and effectiveness are kind of baked into our DNA. We didn't want to do this unless we knew that it actually was going to have a clinically significant impact on mental health outcomes. So that was our first priority. So last June, we worked with our research advisors to do our first proof of concept randomized controlled trial. So we'd already used content and adapted programs that had been tested. We used kind of the World Health Organization and thought about kind of cross-cultural programs in particular. But then when we tested our program, we found that 79% of people who completed the 2 hours that we were having them complete had a clinically significant change in their mood score. So with the Edinburgh Postnatal Depression Scale, that it's a 4-point change in their score. That's the reliable change index. So we had a really high, strong treatment effect too. And so that's kind of what gave us confidence to keep building and going. And over the next year, I think we're going to just do a lot more research, and we're really excited about that.
Good to hear. Thank you.
Yeah, that's really exciting. And I really like you got in there your expertise and your team's expertise, which I think aligns well with where you're looking to go with this, the research, the impact, social impact. So it all tells a beautiful story. Well, restate your ask one more time, and then we'll have to wrap up.
Introductions to integrated delivery networks or health plans would be wonderful. We've got a few paid pilots and early customers, but it would help us grow and learn tremendously.
Perfect. Wonderful. All right. Thanks, Anne. We will follow up with those connections post-event. Next, I'd like to bring on screen Erin Russell with Curio.
Hi, everyone. I'm Erin Russell, Head of Product and Marketing at Curio Digital Therapeutics. I joined Curio because, let's face it, it's about time we focus on women's behavioral health, and that we do it in a way that brings providers and patients closer together. 12 million women in the US experience a mental health related condition every single year, and sex and gender differences do make a difference, which means specific attention to women's health is needed. Here at Curio, we've developed a flexible, integrated digital therapeutics platform that help women manage their health across the behavioral health continuum throughout the cycle of life. That includes support for reproductive health, pregnancy and postpartum, working moms, menopause, and healthy aging. The Curio platform delivers science-based behavioral support following the principles of cognitive behavioral therapy that is specifically tailored to each woman's unique journey. Our initial product is for postpartum depression. 1 in 5 women experience postpartum depression, and 75% of them will never seek or even get treatment. Our 5-week program has been developed by clinical psychologists and has been extensively clinically validated. It demonstrated a significant improvement in clinical symptom trajectory versus control. 2 out of 3 women showed an improvement that was clinically meaningful. And more than that, 70% of the moms who used the program said that they would use it again or recommend it to a friend in a similar situation. The program is available directly for consumers as well as through employers, and can also be easily integrated with health systems, providers, and clinics. We already have our initial providers and clinics signed on. Beyond that, we have a more robust product that is being submitted later this year to the FDA for approval as a prescription digital therapeutic that is intended to be used by women with more severe symptoms as an adjunct to therapy. And beyond postpartum depression, our next product is behavioral support for during fertility treatments that we'll be launching in the coming months. In terms of differentiation, I'll just quickly highlight 3 main areas. Number 1, every product using our platform is extensively clinically validated and studied in randomized controlled clinical trials. Number 2, our platform was developed and built in a way that makes it easy to integrate, whether that's with health systems, providers, clinics, or employers. And that makes it easy for patients to use it. And then number 3, included with our platform is a predictive tool. Our predictive tool was developed, trained by artificial intelligence using millions of claims, and can help identify those at greatest risk. As an example, we can identify 88% of women at risk for postpartum depression by the end of the 2nd trimester. and that has been tested on 20 million unique patient records. And so in closing, I would just ask for your support for connections and partners looking to participate in our pilot ongoing now with postpartum depression and in the coming months with our fertility product. Help us make this clinically validated platform available to more moms and pregnant women who are in need. Thank you.
Amazing. Thanks so much, Erin. Wow, what a powerful presentation, just because we know it is a big problem, 1 in 5, that's huge. And to see that sort of increase in improvement of women, that's pretty impactful. So really interesting. So you're going direct to consumer and through clinicians. So that means people can just download this app and use it on their own.
Yes, so we actually have our platform allows us to make this available both through a web app as well as a native app. And so our direct to consumer product is just a web-based app. It just makes it easier for consumers to access it. Our provider focused product, there's that option. Ultimately, it kind of goes back to our end-to-end connectivity that we offer providers and health systems. We can really customize this very easily between the front end as well as kind of integrating them in the back end in terms of alerts, reporting, et cetera.
Amazing. Okay, great. All right, we'll jump right into it. Ella, can we start with you this time? Things that resonated or burning questions?
Yes, awesome presentation. Also, the sort of use case around people going through fertility treatment seems really smart, not necessarily as relevant for the Medicaid population because it's not traditionally covered as fully, but love that for you. My question is about the sort of primary use case around postpartum depression. So just thinking about like it as a prevention tool versus a treatment tool and the population size differences there. So are you thinking about using this with people who have been officially diagnosed with postpartum depression, which would be a much smaller population compared to like anybody post-birth to identify or refer or start to prevent postpartum depression?
Yeah, it's more of the latter. The more severe product, if you will, that is going to the FDA as a prescription digital therapeutic, that's going to be for the more like severe cases, if you will, women who are diagnosed with postpartum depression. The product that we have available now is more focused on, prevention as well as use by the more mild to moderate patient. And it's intended to be started, the providers and clinics we're working with, they are starting it sometimes after delivery, but many times, ideally, they're trying to get it started beforehand, sometime during the 3rd trimester.
Okay. Great, Tamaya.
Yeah, thanks a lot, Erin. I think what did stick out the most here is that you're more than maternal mental health. You're looking across the entire reproductive life cycle, and that's an interesting thing to consider. And it makes me wonder how you're maybe using data collection to really inform each of these populations, and what do you see the life cycle being with any particular patient? Is it that I signed up with Curio from the very beginning, maybe fertility journey all the way through postpartum and then through menopause? What are you all thinking about that? And then what will you do with all this data?
Yes. So great question. And yeah, we're thinking about all of that. There's obviously a heavy data and analytics piece here. We've really kind of leveraged that as it pertains to the predictive tool that we've developed. But going to your point about the life cycle, really our goal is to be able to help women throughout, not just at one single moment, but throughout the cycle of all those, frankly, kind of difficult moments in life transitions that happen. And so certainly our intention is for women to be able to benefit from the behavioral support that we can offer them throughout all of those different moments, not just one. We just don't have them all available quite yet.
Mm-hmm. Great. And Natalie, your thoughts?
Okay, well, Erin, kudos to you. That was an excellent presentation. I really appreciate just the power of the work that you've done in terms of the numbers, but I'd love to hear more about how personalized the member experience is via the platform. Is it pretty much formatted to the individual? And if so, tell me more.
Yeah, it's extremely personalized. And what's more, I would say the experience with the platform is personalized based on, there are many interactive exercises and activities that allow us, and questionnaires that allow us to help to personalize that during the participation with the program. But the other thing that really makes it personalized is the integration that we have with the provider. Now, it doesn't pertain all the time, right? If someone just signs up as a separate consumer, then we don't necessarily always have that integration with the provider. But if they come through a provider or a health system, we have that integration so that we can then, so that we're constantly talking to that provider, and based on their responses to certain questions, surveys, et cetera, where their mood is at, what the trends have been through their mood tracker, et cetera, we're able to then loop in the provider at those critical moments to deliver truly personalized on-time therapy.
Great, thank you.
Great. And then quick question just before we wrap. So you said you are going to submit through the FDA as a prescriptive digital therapeutic. Are there many of those? Is that a unique differentiator? What do you think that's going to unlock for Curio?
Yeah, so I mean, there are not really for in this space, but in general, right? That product though is separate. Just to be clear, it is a more robust product that's intended for women with severe symptoms, already have a diagnosis, as an adjunct to therapy, and that's important because you have to have. I mean, if you have one product that's prescribed, obviously you can't have the same product that's available without a prescription. And so, but yes, that's absolutely a differentiator. I think that treatment-based product is going to be, frankly, really incredible for women who are diagnosed and have severe symptoms of postpartum depression.
Mm-hmm. Yeah, amazing. Okay, great. And just restate your ask, specific connections you are looking for.
Yeah, so our ask is really connections, anyone who's willing to partner, participate in our pilot that we have ongoing now for our postpartum depression product. And then in the coming months, very soon, we'll have our product for support during fertility treatments. So any interest there, it would be helpful to have those connections. Thank you.
All right, great. Thanks so much, Erin.
Yeah, thanks for having me.
Yeah. Wonderful. All right. And next up, we have Viraj Parikh with MOL.
Hi, everyone. Thanks so much for having me. My name is Viraj Parikh. I am Chief Experience Officer for MOL and one of the co-founders. We know that becoming a mother or parent marks the beginning of one of the most significant physical, psychological, and physiological transformations for a woman or birthing person. Yet, as an OBGYN provider, I have always felt that prenatal visits are too quick, which doesn't leave much time for assessing a patient's mental health and providing the necessary support. Today, 1 in 5 women or birthing people suffer from a perinatal mental health condition, which is now the most common complication of pregnancy and childbirth. But only 40% of providers screen their patients routinely for depression or anxiety. And of those who are screened, over 50% never receive treatment due to difficulty accessing care. Like many providers, I am frustrated with our current fragmented system and feel there's got to be a better way. By bringing together a team of experts in women's health and mental health, tech and startups, my co-founder, David Luck, and I created the Mol Digital Program, which integrates traditional birth prep education with mental health focused support and guidance interventions, all accessible from a mobile device. We believe our program can be used as an early intervention tool starting in the first trimester to screen for and prevent perinatal mental health conditions. We have integrated 6 proven evidence-based components, which include a maternal coach for coordination of care, guidance, and support, regular assessments using our perinatal mental health screening tool, an online version of the Mothers and Babies course for CBT-based psychoeducation, anticipatory guidance via text messages and checklists, a postpartum care plan creation tool that helps moms create their care teams, circles of support, return to work plans, and more, and live and on-demand webinars covering birth prep, parenting, and postpartum education topics. When patients receive mental health support along with traditional birth prep education, they are less stressed and feel more confident, which results in lower rates of complications and unexpected hospital stays, higher rates of breastfeeding, and regular attendance to postpartum follow-up appointments. Our program is scalable and a win-win for both payers and providers. It reduces the need for therapy and hospitalization, thus lowering costs for payers. We save time for providers by handling patient screenings, care coordination, support needs, and increase their revenue using collaborative care and value-based reimbursement models. We just began a pilot at Penn Medicine and ask for your help in reaching our year-end goal of expanding our pilot partnerships with other OB practices and health systems by threefold. Together, we can improve health outcomes for all moms, babies, and their families. Thank you.
Great, fantastic. Let's jump right into it. Natalie, why don't we start with you this time? Things that stood out, resonated about MOL.
Yes, thank you so much for your presentation. I really appreciate the provider lens through which your work is being done, and you've experienced it and you understand it. And as a mother, I would have loved to have been in a program like that. I guess my question for you is that working with your experience at UPenn, what are the outcomes in terms of what has actually been picked up and how has that translated into return on investment? Tell me a little bit more about that in terms of the data.
So we are very early in our pilot with UPenn. We just began this like about a month ago, and we are currently in the patient enrollment phase. So we don't have the data yet to share on the product, but we are working with the innovation group, and some of the data that we're looking to see with that group is the breastfeeding rates, initiation, duration, return to their postpartum visit, and also watching their EPDS scores, pre-program and throughout the program, as well as post-program, to see what the effects are there.
Thank you.
Thank you.
Great. Tamaya, why don't we head over to you?
Certainly. Thank you, Viraj. That was a great sort of overview of what you're doing with MOL. What stood out to me was that you're maybe more than a screening tool, more than just a digital health app. You have several components that link together to provide this care for the mother. And I'm wondering if you could talk to me more about how the patient interacts with all of these different elements in order to deliver on those results that you were just describing the last answer.
Yeah, absolutely. That's a great question. So we have a web-based app that is the hub of the program, and they can access all the tools and all the psychoeducation, the webinars, everything through there. They can communicate with their maternal coach through either video conferencing, text messaging, email, or phone. So we try to reach them where they're at and mode of communication that's most comfortable for them. And the program can be customized based on the patient's needs. First-time moms' needs are very different than second-time and third-time moms' needs. And so we can customize the education program as well as the mental health supports that they need. And in the event escalation to a provider for therapy, for medication initiation is needed, we can help facilitate that as well.
Okay.
Do you have a follow-up, Tamaya? You can ask it if you want. I saw you thinking.
I am thinking on this and wondering how it all works and ties together. Does how many care coaches to each birthing person? So one care coach.
I mean, as we partner with providers, our thought is, depends on, how many patients are enrolled in the pilots. We would initially assign one coach to a provider office, and then as the need grows and that, coaches slate is full, we could add coaches to that office. But ideally, you want to make sure that each coach, kind of if you think about the Noom philosophy, how each person in Noom is assigned a coach that checks in on them on a regular basis. We want to make sure that, we can meet that need for the number of patients that are in our program.
I understand. Thank you.
Great. And Ella, let's jump to you.
I have a sort of similar question to Tamaya, and I think my the thing that excites me is like the breadth of service, but then that also is what gives me pause for you. It feels like you guys are trying to do so much at once, and every single function that you mentioned is so needed and also super resource intensive for your company. And so I would just encourage you to think about which of these services are really like things you can deliver on and translate to value. And on the coaching in particular, I think that there is historically great value where, you know, coaches are sort of embedded in the clinic, or elbow to elbow, there's a warm handoff, there's trust built, and they know the local resource network. And when we try to build that virtually, it can be really hard to scale. The need in Medicaid is so great, and the need for resources often very much reliant on knowing the local network and building a relationship with the patient. And I think sometimes that can be really hard to do virtually, and it can be hard to do, you know, between states. And so if there was any piece that I would say, absolutely it's needed, and you've hit the nail on the head, and it would probably be one of the harder pieces to build, maybe, you know, focusing on some of the other pieces which like feel very relevant and applicable and necessary and actionable. So I don't exactly have a question, but that's just my feedback, and very excited to hear what happens with Penn.
Yeah, thank you so much, Ella. You know, and I think that's really great advice. The lens we're coming from is also potentially using, you know, something that Joy spoke about in the intro session, peer support specialists could really be great coaches for our patients. And you can build that network then across states, and those coaches would have the resources that are available locally for their patients. So that's one of our strategies that we are considering. And then the other piece is that as a provider, we see how, you know, patients are going to multiple different places to find the resources and the information that they need. And we realize that we have a lot in this product, but the whole purpose behind having a lot in the product is to really bring everything into one place so that people aren't having to search for it everywhere. I think you're on mute.
Yeah, thanks. I don't know if maybe it just went by really fast, but can you just give your quick background, your expertise, or what you did before this?
Yeah, so I'm a physician assistant, and I practiced obstetrics and gynecology clinically for over 15 years. And I also worked at a in-person brick and mortar maternal wellness facility prior to my role at MOL. And so I brought a lot of those learnings and interactions with OB providers through that center and patients through that center to my learnings at MOL.
Amazing. Yeah, super important. I love just hearing the backgrounds. It just, I think, completes the story of, you know, why you're going to be the one to make this solution successful. So restate your ask really quick.
Yeah, our ask is just, we want to have more pilot partners. We want to get our product in the hands of more patients. So any connections that you are all willing to make for us would be very much appreciated. Thank you.
Fantastic. Thank you so much. And last but certainly not least, we have Maureen Fura with Mama. There you are.
Hi,
perfect.
Thank you so much for this great opportunity. My name is Maureen. I'm the CEO and founder of Mama. We're on a mission to create the complete maternal mental health care solution. I was pregnant 13 years ago with my son in California, and I didn't think I was going to make it through to the end of the pregnancy, and saw 29 different doctors, told all of them something's wrong, and was ushered out of the office that many times. It took 190 days for me to finally find the help I needed, not to even feel better. So we created Mama based on our team as physicians, clinicians, and advocates. And we have been looking under the healthcare system for over a decade, trying to solve this issue. So Mama is the culmination of all of that work. Mama is, we created it to be a seamless, streamlined screening, referral, and care for women. We know doctors aren't screening because they don't know what to do with women when they screen positive. And even if a woman is screened, 75% are going to go untreated. Our solution is the end solution that begins with physicians and it ends with patients. So how does Mama work? The doctor initiates a screen using a unique QR code. She screens either in the office or remotely. Those enhanced results go back to care teams and physicians. And immediately when she screens positive, she is connected with a Mama Care coordinator. That Mama Care coordinator is a certified peer support specialist. They are her lifeline and will navigate her to care. They will follow up with her and they will check in on her. They will text with her, they will call, and they will help her manage anxiety. They'll do supportive counseling. So in that case of Muriel that shared her story earlier, that would never have happened. We would have caught her and she would have had a care coordinator who spoke Spanish with her if that's what she wanted, and would have followed her and connected her with the right therapist if that's what she wanted, and would have followed up to make sure they were good pairs. Our care coordinators work with women for about an average of 6 weeks, but it can be longer depending on that woman. We're able to scaffold support around women who screen at risk, and physicians say they wouldn't screen unless they use Mama. We have noticed, we found out that women are 5 times more likely to engage in care when they are screened with Mama. So we've taken that 15% of women who actually get care when they screen positive, and we've moved it to 90%. So this is like the secret missing sauce. And it's amazing. So I just want to tell you that it's amazing. So we get women better faster. That's because we're connecting them with a person, a live person. They appreciate that it's a person on the other end of the line. Women report back feeling better in 7 days, not 190 days or ever. We follow back up with our physicians. So we take that burden off of them, and then we let them know about the follow-up activities. We are pre-seed, but we're looking to do our first raise in this July, when we have our first reimbursements back from Medicaid for our certified peer support specialist care coordination. We've had amazing traction. We won the Johnson & Johnson Quickfire Challenge for DC for maternal mortality to address that. We've been doing a paid pilot at the #1 NICU in the country at Children's National Hospital in DC. The March of Dimes is covering 4 paid pilots in DC, Virginia, and Maryland, with the goal of spreading out to 70 other family NICU centers across the country. We have doctors in Florida. We have practices in LA, California, and DC. And we're adding so many physicians to screen, like I can't even keep up. And it's just such a powerful thing when we can catch a mom and we can immediately respond to her, and we can get her connected to the right resources and let her know that she's not alone. I think it's really satisfying. We know we're saving lives. So thank you so much. I got really excited, you guys. Sorry.
No, that's okay. That's great. No, thank you for that presentation. I think I can speak on the whole behalf of the whole panel, that we can feel your energy and passion for this topic, and that you've really put your heart and soul into it. So we just want to make sure that that translates into you pitching the business case of what you're developing, and not, discrediting it whatsoever. But love the passion and hearing about that vision. I really like, especially in a short pitch, when entrepreneurs really state where they are now and where they're looking to go. And I think we got that picture in your vision for expansion. So thanks for mentioning that. Ella, why don't we start with you and to start off the feedback?
Yeah, thank you, Maureen. That was really great. My question is about your peer support specialists and what your criteria is for hiring. So what kind of humans are those? How do you train them? How do you ensure that there's quality there? How do you reflect the demographics of the population you're serving? That sort of thing.
So important. Right now, we're working with peers who are already certified peer support, have already been trained through the peer support training in their state. So we have a training tomorrow with a California group and a Florida group. And we are hiring based on what our population that we screen, what they look like and what languages they speak. We do our own training of these women. They have to have lived experience. They have to be at least 2 years out. And we provide the supervision. So we adhere to each state's certification processes for their peer support. So it's covered in all the states, which we learned earlier. So we really feel like we finally cracked the code for 40% of the births that are covered by Medicaid, that we can really bridge the gap for these women who have, at least for these women, we can use our certified peer support specialists for this.
Great. Okay, Tamaya.
Yes, thanks a lot, Maureen. This was great to hear about, and your passion. It's always good to see a founder who's really excited about what they're working on. Maybe we have a couple of questions around, in the same vein of your initial screening with providers. How you're finding these providers to come on board to be part of the screening process, and then what is your screening tool? How is it differentiated, and in any way is it customizable for each parent or for each birthing person?
Awesome. So we're finding our physicians through word of mouth and by reaching out. They want to screen. That's been very healing for me, is to know that they do want to do the screens. They just don't know what to do with her. And so physicians are telling their physician friends. So that's exactly, that's how we're spreading, is our users really like our product. They like knowing that we're following up, and it's so easy to use, and they upload the screening report, they get their screening reimbursement, and they know that they're doing good by their patients. Right now we use the EPDS, but we're also adding the PHQ-9. And we've been talking about adding a risk assessment to the pregnancy part, and then another one at the postpartum part. We also have automatic rescreen, so that once the initial screen has been initiated, Mama will kick out a screen based on evidence-based rescreening timelines. So that's what our screening process looks like. And we also can screen dads as well. Yeah, because we know 1 in 10 dads are experiencing this as well. And that if a mom is suffering, there's a lot of pressure put on the partner as well.
Yeah, that's really important too. Okay, and Natalie?
Okay, thank you so much, Maureen. I appreciate also your energy and what you bring to this discussion and the work that needs to be done. My question to you is, as a physician, I can appreciate your comment about physicians not knowing what to do next, or providers not knowing what to do next. So to your point, speaking of scalability beyond the capital region, how do you verify that those community resources outside of the app or the platform are actually quality and culturally effective to meet the needs of the pregnant person? So tell me more about that vetting process in making those connections to the community resources, which are seemingly elusive. Thank you.
So thank you so much for your question. So our certified peer support specialists come from the communities that we work in. So before we start in any location, we're hiring from within the communities that we plan to work in, and they're coming with vetted community resources. So we always tap into the local experts, and we look to make it so we know that we want to talk to people that come from where we come from. So that's a really big cornerstone of who we bring on in our team.
Great. And Maureen, just restate your ask, and then we will wrap.
Yeah, we are looking to bring on stakeholders, key investors that are really aligned with what we're doing. We would love to work with the California Healthcare Foundation, as we want to be able to be this, we want to be able to service these moms with our certified peer support specialists that we know work really well. And we're looking for health systems that want a better way to screen their moms, support their moms, and refer using our platform. Thank you.
Fantastic. Okay, great. Thanks, Maureen. And I just want to say, give a really big thank you to our expert panelists. Thank you all for joining this session. Thank you to our founders, and of course to Joy for kind of co-creating this quick pitch session within the conference, and an honor to be a part of it. So thank you again, Joy, and I will pass it back to you.
Thank you so much. It's really refreshing to hear all the energy and ideas that are coming to the forefront. We need you all, as you've heard earlier with the treatment shortages. All that you're doing is really critically important. And thank you to the panelists for taking interest in this important work. Thank you, Anna.